Good afternoon, and welcome to today's program titled Strategies to Improve Physician Efficiency and Productivity. My name is Chris Cheney, and I am an editor for Health Leaders and your moderator for today's event. Our program will be 60 minutes in length. Note that an on-demand version of this program will be available approximately one day after the completion of the event and can be accessed using the same login link that you used for the live program. Today's program is sponsored by Augmedix. Thank you to our sponsor and to you and our audience for giving us your time and attention. Before we get started, we have a few housekeeping details. To ensure that you can see all the content for the event, please maximize your event window and be sure to adjust your computer volume settings and/or PC speakers for optimal sound quality. Second, you will find a resources list in the upper right corner of your console player. Here we have listed the webinar slide deck and multiple resources from our sponsor for you to interact with. Next, at the bottom of your console are multiple widgets you can use. To submit a question, click on the Q&A widget. It may be open already and appear on the left side of your screen. You may submit questions at any time during the presentation. However, please note that it is likely that your questions will not be answered until the Q&A portion of the program. Finally, should you experience any technical difficulties during today's program and need assistance, please click on the Help widget, which has a question mark icon and covers common technical issues. I'd now like to introduce today's speakers. David Lundquist, MD, Chief Medical Officer of Augmedix. Kirk Davis, Executive Director of Operations at Dignity Health. And Ann Perkins, Director of Clinical Operations at Dignity Health. Thank you all for taking the time to speak with us today. And with that, the audience is yours.
Hello, this is Davin Lundquist, and we're excited to be here today with you. As many of you who are associated with healthcare know, the problem of physician and even staff burnout has been growing for many years. It's been a problem that we've been watching and been concerned about, and during the last few years with the pandemic, it's definitely only gotten worse. And what we're seeing is that with additional challenges related to added technology, the need to be virtual and to meet patients where they are, the need to keep up with constantly changing information and landscape in terms of what our patients need from us has only added to the existing burden of that has sort of been around with healthcare and our clinicians. So our goal today is to as practicing physician and administrators in a large health system to discuss kind of what we're seeing, some of the trends that we're seeing, and how technology is both contributing to the problem, but could also potentially be a solution. So maybe Kirk, I'll start with you and see if you have any initial thoughts around kind of this problem that we're seeing around efficiency and productivity in healthcare.
Yeah, just can you hear me okay?
Mm-hmm.
Yeah, I just, I think there's a phrase that comes to mind, and it's time poverty. And what I'm seeing is physicians having a lot more regulatory burdens and a lot more patients to be seeing, and some challenges in balancing quality of life. And, up crops these technological assists out there that might improve those things. And because certainly their lives are getting busier. I know you can attest to that, Dr. Lundquist, because you're still practicing. And so, yeah, it's just I think it's only going to increase the levels of responsibility and patient needs are only going to increase, and we've got to figure out a way to help them manage their daily lives so that they can have a life outside of practice.
Great, appreciate that. And what do you see, at the clinic level, as you work with, physicians and staff, in terms of, the amount of work that they sort of have on their plate and dealing with the EMR and the challenges we've always seen there?
Yeah, actually, at when I worked at Santa Clara Valley in the health and hospital system in Santa Clara County for 15 years, and I was lucky enough to work with a physician who actually went into working on physician burnout full time, and had put together a program to address that. But I had a lot of opportunity to talk to him and other physicians about the burnout. And part of it seemed to be what physicians want when they go into the field, and what gives them meaning and a sense of purpose. It felt like a lot of that had sort of been washed out of the field. And it became very robotic. It became very documentation related. Relationships with patients were de-emphasized, and just a lot of the meaning of the work didn't feel like it was there for physicians, and attempting to put that back in this environment with regulation, with documentation, with RVU pressure. It's an interesting challenge. So that's what I've seen and heard a lot about that from physicians and other providers.
Yeah, I think that's well said. And in my experience, both as a physician, user of the EMR and technology, as well as being a former CMIO with Dignity Health, and on the clinic side, and kind of rolling out different EMRs over the years. I think this analogy I sort of noticed with, like, we talk about like distracted drivers, and how obviously we want people like focused on the road and not like, texting and doing, silly things that would keep them from being safe. And I think in a lot of ways, our physicians and our staff are distracted clinicians, right? They have technology that's sort of, barking at them and asking them to pay attention and look at, tasks and alerts and, information, as well as, just like you said, the documentation is an increasing burden with, the regulatory requirements that are there and continue to grow, it seems like. And then, during the pandemic, we added in, video visits. So now you're sort of fumbling with, another layer of technology to interact with your patient that kind of distances you even more in some ways. But also, it's obviously there's a lot of benefits to that as well. But I think, many times I was serving as like tech support for my patient, right? Like, oh, your audio is not working, and you're like pointing, click here, or, trying to help them just, get, into the session. And so, while there are, again, a lot of advantages and benefits to having, technology as a part of our environment, it just adds to that mental burden and that time shortage that you mentioned, Kirk. Are you hearing from physicians? We have some stats on the screen around, people considering retirement and, maybe even looking to change jobs. Have you guys seen that? Are you experiencing that with any of your, doctors?
I've seen a lot of that, actually. And I've also seen a lot of depression. Suicide rates are up amongst physicians across the country. It goes, I guess, beyond burnout. It's a pretty serious issue.
Yeah, I would just add to that for folks that don't know this about Ann. She's a licensed therapist, so she is really close to that issue. And I've heard anecdotal comments from docs and APPs that they're just tired of all the administrative burden, because they got into medicine to practice medicine, and they just get overwhelmed with some of the admin stuff. And we're slowly but surely trying to figure out ways to help them get back to focusing as much on medicine as possible, get rid of some of this other noise that's necessary and required noise, but we can alleviate the burden a little bit.
Yeah, well summarized. So, I think one of the potential solutions to this has kind of been this idea of, bringing technology into healthcare to offset some of that burden. And, I think the promise of technology certainly makes sense. And we see it in lots of other industries, right? Where it does make it more efficient to, book travel, or to, look up a restaurant and figure out where we're going to eat, or, buy movie tickets, or, whatever it is in our lives, that has been made a little bit more, accessible and easy to do. And yet in healthcare, it feels like the promise of technology hasn't quite hit it yet. Like it's like we're a little bit behind maybe, other industries. What have you guys seen in terms of how, technology has, kind of interacted with healthcare, or where it's maybe fallen short, or just, hasn't quite, caught up with other industries?
Speaking for myself, I was with Dignity a few years ago when we were talking about virtual visits and piloting on a very small scale. And then I left for a couple of years and came back, and thanks to COVID, it's the norm, or it is a norm now. In fact, on a personal note, while I'm sitting here, my wife is out in the other room, having a virtual visit with a doctor post a hospital stay. And I mean, it's just like terrific that she can do that and not have to go somewhere. And it's not the solution for every patient, but it's a solution for so many. And so I'm really pleased to see that our system, as well as others, have embraced the technology that's available to make the pathway for patient-provider contact easier.
I think the way that I see that technology has come in, I think in many ways it does make patients safer. And I have a friend that he's a doctor in the ICU, and he was kind of showing me all the predictive modeling and how we make decisions now, and the drop-down menus in Cerner or Epic or whatever. And what he was saying that we haven't quite figured out yet is, like, he was saying, where do I come in, right? After all my training and all of my experience, I go into the ICU and I see a patient, and I've got a million algorithms and drop down, but where am I needed as an experienced clinician here, right? And I think that does take some of the meaning out of the work, and there's not a sense of all my training, all my experience, where do I sort of beat the algorithm? Where can I come in and add value to this experience? And I think that he experienced that as being quite difficult. And I did get to work quite a bit with a neurosurgeon at San Francisco General who he said, he developed a lot of tools that they use in the ICU for brain injury. And he had told me, I'm still at a point where if I see a patient and they're really not doing well, I'm not going to look at all my monitors. I'm going to call for my most experienced nurse. So trying to figure out, like, where does that most experienced nurse add value, and where do you want to look at the monitor? I kind of feel like we're still in the middle of that piece of it.
Yeah, no, I love that. I think technology, and certainly when you think about all of the data, right, that we're collecting with these electronic tools. I mean, we have access to more data than ever before, and I think sometimes, it's overwhelming, right? And so we need the power of automation and technology to kind of sift through that data, maybe organize it, run through some basic algorithms, right? That, computers have the ability to do that with very low errors, right? Because it's an automated, algorithmic approach. So, they're not going to make a miscalculation or something, right? But it ends, in my experience, it sounds like with this doctor you were talking to as well, there comes a point where it feels kind of siloed, or it's like, it's a narrow view. And while the output may be correct and it may have been, achieved very quickly, it's still just sort of data, right? And so I think at the end of the day, there's a human that you have to apply that answer to, right? And and if the computer didn't know that, they had 3 other diagnoses, or that they're, something else just happened in their life that's adding stress that wasn't even in the chart, right? Like you didn't know that their mother just passed away, or that, some other, challenge that they're facing that has an impact on their health and that stress. So I think, as humans, we have this unique ability to take a lot of complex data and kind of bring it together and find the nuance in all of that, right? So I think to the extent that computers and technology and automation can do some of the work, right? Some of the heavy lifting. And then, we sort of pair that with our unique humanness, right? That kind of separates us from the computers, and then, using that to be very specific and patient centric for the person that's sitting across from us versus like, a generalized answer. Have you guys seen, any technology that maybe is working in healthcare, or that people are, excited about, or areas?
One of the things that I've been pretty impressed about is looking at variation in practice based on region of the country and other things. And, it turns out that a lot of decisions that are made are not really necessarily evidence-based. They're based on where you went to school, or who your mentor was, or where you're working currently. And actually being able to look at, well, what is a best practice and what does provide the best patient outcomes? And whether you're in Seattle or Atlanta, what's the best thing to do? I think that's been really powerful.
That's interesting.
Yeah, and I've seen again. I was away from, our setting of dignity for a couple of years. So coming back, it was a marked difference in the increased use of technology for, voice to text, voice to transcription into the EMR, use of scribes, just seeing a much more widespread use of that. And what I'm hearing from providers is that are utilizing these tools, it's a game changer in terms of their ability to kind of step back from the ledge a little bit, because they just get so, they're just inundated with the messages and the everything that they're having to track, and anything that can ease that burden a little bit, they're embracing technology at different levels. And because some it's right for some, and some it's not right for others. And so you kind of pick the tool in the tool belt that fits them. But what I'm also seeing as a patient, as my family, our patients, is, and what I've heard from patients in our ambulatory setting that I've actually spoken to, is that they're, not everybody, but they're embracing this technology as well, because it's improving access, it's speeding up care, and it's probably most importantly, it's making things convenient for them, more convenient for them. So it's a win on the patient side, win on the provider side. So I see positives. I think the next what lies ahead is going to be very good.
Yeah, I think that's great. I think patients, just like the rest of us, right? We see where technology does help, right, in a lot of aspects of our lives. And so I think when they see it work in healthcare, I think they welcome that, right? They're definitely not resisting it. It's as long as it's sort of contributing to their positive experience. I think back to years before we had the EMR, and we were getting close to implementing it. And one of the things that I observed was, I'd have this stack of paper charts on my desk, right? That, I don't want to admit that I was ever behind on my charting, but, maybe on the, rare occasion that I had some charts to catch up on, there would be this, like medical records clerk, right? Like walking through each office, and they would look through all the charts, right? And on my desk, and I know they were trying to find a chart, right, to either put like a result in, or file something, or maybe a patient was coming in for a visit. And I thought, I sort of was thinking how long it took them to go through all the charts on my desk, right, and then go through every doctor in the clinic. There were maybe 10 of us in that site, and just how inefficient that was, right? And so, something as simple as now, all the records are, a click away, and, you never have sort of a lost chart, if you will, because, they're available. Now they're available, when I'm at home on call. There's some really tremendous benefits to having an electronic version of the chart that has moved us forward, tremendously, and it's been, really helpful. So, we certainly don't want to paint the picture that, it's been all bad, but I think that it's just that extra burden, right, of interacting with all of this and all the data and all that it's created has created that challenge. So, so then with that backdrop and what we've discussed so far, how do we sort of regain that ideology, if you will, of the clinicians, both physicians, advanced practitioners, and our staff, and why they went into healthcare to begin with, which most likely was because they wanted to have a positive impact in people's lives and have a career that they felt like was, helping people and connecting with people. How do we get that back, or what are your thoughts around what is needed there? Either Ann or Kirk, feel free to jump in.
Yeah, I got a noodle on that. Ann, do you have any initial thoughts?
How do we get the happy back in the workforce?
How do we return to happy?
Yeah, I do think that, as human beings, as the animals that we are, we do need a certain amount of connection with others to be well, and one of the things that we have been doing, we formed a new provider onboarding group, and part of it is to be with new providers to our system through their journey as they begin for the first year. And some of that stuff is very nuts and bolts, having proctors and super users working with them on the technology, which I think is important, and making sure that we're there to help them get through any kind of the bumps in the road on that. But part of it is bringing people back in. It's having lunch with them. It's getting dinners together. It's forming little pods of people so that people do feel connected with others at work. And as Kirk mentioned, that my clinical background is as a marriage and family therapist, but I've been in healthcare administration for a long, long time. But I just see that these points of connection are so important. And for people to feel like when I have an issue or I'm struggling with something, I know who I can reach out to. I feel like that's very important.
And just on the heels of what Ann just said, much more eloquently than I could have, there's plenty of studies and articles out there and about taking over operations in arenas that are, humming along smoothly or not. And, I'm reminded of what I used to tell my kids as they were growing up. It's like, you don't have to like it, but you still have to do it. And in our environment, people do have a choice whether they want to do it or not. But I think keeping lines of communication open and having a complete willingness to work with providers and providers working with the operations folks to address problems. There are going to be some things, maybe even many things that, it's a regulation, it's a law, it's the way the standard of practice, you have to do it this way and this is what needs to be done. But if we always have a questioning nature and work to improve workflows and, stick to lean principles, there's so often different ways to do something, and you change it, and then maybe a year or two down the road, there's an even better way to do that thing. And so it's just what Ann and I have worked real hard to do is create a level of communication and trust, and that we'll do whatever we can to try to make life easier for folks, but there are certain things that we don't have control over. And it just is what it is. But I have seen that manifested in our market where we work, where folks have been very responsive to at least the effort to improve things and get to that happy place that you just spoke of.
Yeah, and I noticed that somebody was asking about how do you work with physicians who are struggling and don't want to do voice or text, drag and remote scribe. I think a word that's not used enough is discouragement. I think I see some providers, and they may be boomers like myself, who feel discouraged about technology, and they feel discouraged about their ability to utilize technology. And just for instance, when we're onboarding these new providers to us, we pull our supervisors out of their clinic for 2 whole days. And this is a big, big investment for them to come out and go elbow to elbow with those providers. But we feel that it pays a great benefit in the future because of the relationship that's formed. And also, if there's any discouragement around, how do I get over the hump with this new technology, or what am I doing? We feel like spending that amount of time with somebody helps them feel truly encouraged to utilize the technology and to get help from people. So I think sometimes in the healthcare environment, there's so much like, we can't pull people out to do this. We can't take the time to do that. And sometimes we really need to take the time to help people, and it pays great dividends going forward.
Yeah, and on the heels of that, Ann, I would just add that sometimes solutions aren't complicated. I've had chats with providers who, are struggling, and I ask them how their typing skills are. I know that might seem kind of rudimentary, or, maybe in college or with, like, my kids learned how to type really well with AOL Instant Messenger. That probably dates me a little bit, but and when I talk to providers who are not skilled typers, I show them and lead them to, free websites, tutorials that can help people improve their typing skills. And these are real tools out there that, if you give it a half an hour a day, I can just about guarantee you in a month, 2 months, you're going to increase your typing speed. And that improves quality of life when you're not spending an inordinate amount of time on the keyboard in front of a monitor, hunting and pecking on that keyboard when you can touch type. And it sounds basic, but I harken back to probably my best class I ever took in high school, which was typing. And it's little things like that. I mean, that's not, we don't think of typing as technology, but it's any little thing you can do. It's the small victories, the low-hanging fruit, that if you can help a provider move in a positive direction, it affirms and strengthens the relationship.
Well, that's great. Yeah, sometimes it is just, the basic things. One of the things that was interesting to me, obviously at one point during the sort of the height of the pandemic, pretty much all of our visits were video or virtual. And initially there was, I think the patients were those that could kind of figure it out and get on it and take advantage of it. Thought it was great, right? It was very convenient. They're at home, if I'm running late, which of course never happens, but if I am, their waiting room is, their home office or their living room, wherever they're doing the call. So they're much more comfortable, right? So there are all these kind of cool benefits to this. And so I was kind of curious when things started to open up, like what would happen? Would patients, come back to the office? Would they be hesitant? What would they prefer? And it seems to me that, there's still a real desire and preference in a lot of cases for people to come in and be in person, sort of face to face, across from me as their physician. And that, like, even some patients have said, yeah, I just needed you to examine me, like just that. So I think I'm curious what you guys observe or hear from, your, clinicians around this concept of, that sort of in-person human interaction, the healing touch, if you will, and the value, and maybe even how that contributes to, job satisfaction and happiness, fulfillment. And what do you think?
There's a couple of different things. I do think that there tends to be, like, we get into some rigid thinking about this, like in person is always better, virtual is always better. And Kirk and I actually are trying to push more virtual visits right now because it's gone down since COVID. And we do find that we have several providers whose life satisfaction is really increased if they can have full days of virtual visits at home. So be it their family situation or whatever, it's better for them to have 1 or 2 days a week when they can be virtual. And we're having a hard time filling up the full docket for those people now so they can continue to do that. So I think it's probably a mixture. I had an opportunity to interview one of our patients yesterday who is a 92-year-old oncology patient who's had a great outcome. But she was telling me how wonderful it is for her, because she lives an hour and a half away, to be able to do virtual visits with her oncologist now. And she loves it. She thinks it's fantastic. So I don't know. To me, it's not an either or, but maybe a good balance.
Yeah, I would agree, and I just can't help but thinking it's a little bit analogous to online education. I teach college on the side and have for quite a long time. And, when online first became a thing, everybody in the academia referred to it as non-traditional, pathway to education and getting your degree. And now you don't hear that anymore. Major colleges, online enrollment outpaces, or at least a few years ago was outpacing ground enrollment at brick and mortar universities. And now virtually every university in the United States has not only online degree programs, but just a plethora of offerings. So it's become a norm, with learning outcomes being equivalent and in some cases better. And I say that only to say that, the last 2-3 years, 4 years of all of this added technology is I think going to only continue down the road of acceptance, and more people, including seniors, who can't make it in or are very comfortable, become comfortable seeing their doctor virtually. I think I think about a third of our primary care physicians in the Santa Cruz market do virtual visits, and I've had requests of others wanting to start dabbling. So I think it's just going to become more and more a norm for those patients that want to do it this way. Personally, I've had my first virtual visit a couple weeks ago, and I'm like, man, it just saved me a whole bunch of travel time. So it was very appropriate to do it that way. And I'm a big believer, but I'm pretty close to I'm biased. But to answer your question, Dr. Lundquist, I just think it's like that rocket ship is just starting to lift off the launch pad. And I think literally the sky's the limit, no pun intended.
No, I think those are great observations and thoughts, and yeah, I would agree. I think being able to work from home and do video visits, I definitely enjoy those days because it's it's a quality of life thing. You have more time in your day. You're not traveling. You're when you have a break, you're at home versus you can go run to your own fridge instead of the mini fridge in the break room. And so it's I can pet my dog or whatever. There are a lot of intangibles that are kind of interesting. So I love that. I think that's I like sort of not trying to make it a competition, but just certainly being both provider and patient centric here, and just saying, hey, what fits the situation, right?
And I think in terms of provider burnout, taking the time to really understand what's going to work for that provider is also really important. Sometimes, I'll get a word from one of our physician leaders, so-and-so physician is really unhappy and they're burned out and they want to quit or whatever. So can you please meet with them and figure out, how you could support them, right? And sometimes, like this provider recently, it was like, she wants to be at home 2 days a week, right? So what can you do to push enough of my appointments so that I can have 2 full days? And she has young kids at home. I can have 2 full days at home virtual, right? And so that's kind of just listening to her and what fits for her and her work-life balance, and how do we get this technology working to give her a better quality of life.
I think that applies also to the support staff, the medical assistants, and the medical office receptionists. That if one of the providers is just for example is doing a half a day of virtual visits, the MA that supports that provider is not rooming patients physically. They've already set up the virtual visit so they can focus their time on all the myriad duties they have: chart scrubbing for future visits, checking on labs, calling patients to see how they're doing, all the background stuff that most folks don't know about, especially patients. And it just helps them catch up and not forever being 1 step forward in the sand dune and 2 steps falling back. I've heard really positive things from staff about virtual visits helping them keep their head above water.
Mm-hmm.
Well, that, one of the themes that I wanted to make sure we covered today was, just like the staff shortages that we have, right? So I think, if I do a video visit, right, like I don't need someone at the front desk, to check anyone in. The MA that might be working with me can do a bunch of check-ins probably pretty quickly, right? And the patient's going to do their own vitals, et cetera. So, what are you guys seeing in terms of, staffing? Is that a challenge for you to have enough staff? It seemed like it was at one point. Is that still what you're seeing?
It is. I mean, we're in Santa Cruz is a ridiculously expensive place to live and buy real estate or rent a place. And so particularly the staff, the MAs and the MORs that we try to hire, it's very, very hard for them to live in Santa Cruz on that salary. So it's tough for us to recruit for sure.
It is, and there's just a much more finite labor pool, available labor pool because of the population. When I was with Dignity before in Sacramento, it's a much, greater metropolitan area, and it was not as, in talking with my peers up here recently, it's not as big of an issue hiring and maintaining staff. But in Santa Cruz, much smaller market, it is. So it's incumbent upon us to make sure employees are happy, providers are happy, and Yeah, Dr. Lundquist, it's tough. It's tough to staff, and it's probably not just in healthcare. Well, I know it isn't, but that is an ongoing challenge.
Yeah, and that's another thing for Kirk and I have pushed to make any jobs that can be remote, make them completely remote, because if you're living in Wairika, California, where your rent is a quarter of what it would be in Santa Cruz, you're happy to take that salary and work remote, right? So trying to figure out how you take your remote workforce and keep them engaged and connected and productive is another whole topic. But just because of how expensive it is to live in Santa Cruz, we have to really make that calculation. Like, could we have a remote person do this position?
Yeah, I mean, it seems to me just in the economy in general, people are having trouble finding staff. I mean, restaurants haven't resumed normal hours, grocery stores don't seem to, you got to bag your own groceries. Like it seems like everywhere you go, we're seeing that. So I think it's no surprise it would hit healthcare as well. And then even just physicians, as a primary care provider, I've seen a lot of new patients in the last year who tell me that their physician retired, early, or surprised that they don't, no longer taking patients, whatever. So I think those who were kind of on the fence, just went ahead and said it's time. And so, it does feel like there's not enough, people. I think the nursing community for sure, right? I mean, we hear about it on the news all the time, like crazy. They're paying, more than a doctor in some cases, right? Because there's such a shortage. And I think one of the things that, people outside of healthcare about, they're like, oh, it's a great time to go become a nurse. Everyone should do that or something. And what they don't understand is that, unlike some industries, and I'm sure every level of, professionalism in whatever industry would have some of this, but, it's not just a matter of like opening up schools or having, add 4 or 5 more people in your classroom, right? There's at some point you have to do a clinical rotation, right? And so to train extra staff, new people, new physicians, new nurses, they have to go do a rotation where they shadow an existing, provider. And so, if we're already short-staffed and we're already have a workforce that's overburdened, you can't just say, hey, take on, 3 more nursing students or 3 more, med students, right? That's not going to work. So I think our ability to replenish, the supply is also, in question. So, I think a theme of today's, session is how technology can maybe help solve some of these problems, right? And so we've talked about some already. I think video visits, virtual visits is key, and we can certainly continue to discuss that. And then, I think just to kind of, as a closing topic here, if we can just sort of talk about, where you guys see technology, making a difference, helping overcome the staff shortage, helping overcome, the burnout, improving quality of life for our, clinicians, so that it becomes a profession all across the board in healthcare that people want to, go into, like we always sort of have seen it.
I'll just throw something out that I've noticed. I've only been in the Santa Cruz market for about 8 months, but I'm part of a weekly provider recruitment call where we go into depth, quite a lot of, dig deep about what positions we're recruiting for, who has applied, and a little bit of background on those folks. And the provider recruiter will share information she gleaned from the initial outreach to either an MDDO or an APP. And I'm starting to see an uptick in people, potential applicants, wanting to know about, they're not calling it quality of life questions, but they're wanting to know about, the EMR. They're wanting to know about, what kind of technological support there might be for them, because they don't want to come into an environment where we're still using a chisel and a stone tablet. They want to know that we have some good direction on technology that might be improving their lives. And whether that's some of the things we've discussed, already today or not, I don't think all of them have a handle on some of the things that are out there available, like, scribes, for example, but they're definitely asking, and I've not seen that prior to the last 8 months.
Mm-hmm. Yeah, I think younger providers too, and we had a wonderful primary care doctor, Dr. Smythe, who he wanted to surf every morning and pick his kids up every day from school. And he was just a wizard at all of the technology. And he really demonstrated to us how technology can be used to support the work-life balance. And also he wanted to have a lot of face-to-face time with his patients, and he did. He was a wonderful, wonderful physician. But to me, he showed, like, okay, these technologies, these tools are going to help us achieve what we want in our work-life balance. They're going to help us achieve working at the top of our license and working with our patients in the way we want to. So to me, he's a bright light in that way. And to me, that's the North Star, right? Let's use these technologies in the way that's going to support our life and then support the providers and how they want to work with the patients.
And maybe you could go into just a little more detail about, what he was using, or, just give us a sense for how he did that.
Well, he definitely, he did use a scribe. He pushed very hard on people like me and Kirk also to make sure that he was adequately staffed and that his staff was adequately trained. I mean, there's certain basics, some kind of nuts and bolts that, we certainly work with every day. So he wanted his staff adequately trained. He wanted to fully implement every piece of technology that we had access to. So, like, he was the head of the Cerner team in Santa Cruz, and he could figure out every hack on Cerner that made it faster. He would work with Cerner to develop new ways for us. So he was working on that. We have something called Notable, which checks in our patients and takes their co-pays and whatever. He worked on that, worked on implementing that so that it was saving everybody time. So I saw him kind of fully exploit every piece of technology that we have. And he sort of brought the gospel to everybody, like, the technology is not our enemy, it's our friend. This is what's going to give us back those human pieces that we want, right? If Notable...
Yeah, Ann wasn't...
Go ahead.
I'm sorry, and Ann wasn't joking. He was one of those... We have more than one physician that does this, but either in the morning or at lunch, they'll go down and catch a few waves on the surfboard, and because they've managed their time so tightly, and utilizing technology to its utmost. They go surfing, come back, and I've seen them see patients with their hair just a little bit still wet, because quality of life is real big, no matter where you live. It's just the vibe in Santa Cruz, but. He was real big on balance and making sure that if technology could improve his life and the lives of his patients, he was all about that. And doesn't mean you need to be fully immersed like he was, but you absolutely can, whether you're using Dragon or some of the other things we've talked about. It's just there are ways to make subtle improvements. You don't have to completely learn a new language, so to speak. You just make subtle changes, small changes, and they can have great impact on your I've literally heard doctors say, some of the things we talked about being a game changer in their lives, whether their kids are noticing they're around more, their significant others, and when you start hearing stuff like that, you're like, okay, I'm got to continue to figure out how to best support this, because if they're happy, I'm happy.
Mm-hmm.
Yeah, no, I think it's great. I've been a user the Augmedix solution for 9 years now, and I can tell you, that it saved me countless hours, over the years, and I think what's interesting is now that we're kind of hitting this situation where it's hard to find staff, it's hard to find people, and we've talked about other situations where having remote support can be helpful, right? And I think the way we sort of can put technology and connect to a remote documentation specialist that can help the physician with their documentation, but they don't have to be there in person, right? That that's the way that technology is being used, and obviously there's a lot of people in that space that are looking for these kinds of solutions, and Augmedix is one of them, which obviously that I've enjoyed, but I think regardless of where it's coming from, I think looking for those types of things that really add time back, right, to our clinicians is going to be key.
Yeah, and I'd add, just because I don't think we mentioned it in this hour, is how patients view this. I was part of the pilot to the product you use in Sacramento. I got 5 years ago now, and I initially was a bit of a cynic, thinking products like this weren't going to be embraced by patients. And then as our pilot progressed positively, we found that 8 to 9 out of 10 patients were, yeah, let's do it. Sure, if this makes your life easier, it's fine with me. And I just very, very pleasantly surprised that patients embraced this. And so I think that's important. I really had to kind of do some self-reflection and think, would I be comfortable with that? And then the more I thought about it, yeah, I would be. But it's okay for those that wouldn't be, in my opinion. It's not going to be for every patient. Yeah. But that's okay, because it's a tool that doesn't fit every problem you're facing, or every encounter. It's utilize it where it can be utilized.
Yeah, no, I think it's funny. I've had some patients who are professionals or just have a lot of busy work in their own lives, and they're like, oh, I wonder if I could get that for my job. Someone that'll do my kind of listen in and do some of the work for me. So yeah.
Well, Kirk and I are trying to get that, so wish us luck.
Okay. Well,
I think Ann's trying to replace me.
Yeah. She's gonna get an AI version of you.
Yeah, there you go.
Well, we're running out of time, and there's a number of other things I would love to discuss, but I think in summary, I think we all kind of see the challenge that's there, and we understand that technology can definitely help. And one way that I kind of have viewed differently, looked at technology differently lately, is to kind of look at it as just a member of the care team, right? Instead of, some people have talked about, oh, AI is going to replace doctors or this or that, and I think rather than look at it as you've referred to some other situations, and either or, right? Let's just say, hey, we have all different skill sets on a care team, right? Because we need all those different skills to really treat patients and take care of the complex thing, which is healthcare and wellness. And so I think technology can just be another member, right, of that care team, and it will do different things, right? In some cases, it may help with documentation. In other cases, it may help check in a patient. But however we're using it, I think we should continue to look for ways for it to be complementary and integrate in, and not be afraid to do that. Any closing thoughts from either of you?
No, I look at it. Oh, go ahead, Kirk.
Go ahead. No, go ahead, man.
I was just gonna say, I mean, it's kind of like I bemoan the fact that I see families in restaurants, and all of them are looking at their various devices while eating dinner together, and I'm very against that. But part of it is like, this is a genie that we can't put back in the bottle, right? We need to learn how to utilize it in an appropriate way that actually supports patients and supports our staff and providers. And I think that's the part of the journey that we're on right now. But it isn't an either or journey or a rigid journey or vilifying the electronic or technology. It has to be a way to integrate it in a healthy way.
Yeah, it's well said, Ann. I think the only thing I would revert to is my tool belt analogy that, this is one more, probably a tool of some gravitas that you can throw in your operational tool belt, and as you go about your day, you apply it where it's accepted and needed and appropriate, and if not, then you utilize a different tool in your tool belt. But it's not the solution. It's one of the solutions, potential solutions.
And I will say, just maybe as a closing story, that 92-year-old woman that I interviewed yesterday, her oncologist at Dignity literally saved her life because there had been a mistake made in an academic medical center. She had an issue that was inoperable, and in fact, our oncologist caught the fact that it was operable, and they were reading it incorrectly. And that is one of the people who, she's going on Augmedix this week, I think. She was feeling terribly burned out, just didn't feel like she could keep up with the workload. And she's an amazing, amazing doctor and cares about her patients so much. But she needs some technology in order to help her continue working as a physician. And Kirk, I think you can echo this. She's so thrilled to be going on Augmedix right now, and she feels like this is the boost that she's going to need in the time that she needs back to feel sort of re-energized to keep going.
Yep, I totally concur.
Thank you. That's very well said. And the reason that, I do what I do is to hear stories like that. Well, I think we're up on time, and, we do want to get to some questions. So we appreciate everyone being so engaged and taking time out of your day to listen to our thoughts. And we'll go ahead and see if there's some questions that we can get to now.
Thank you all for an excellent presentation. This now brings us to the Q&A portion of the program, and I think we've got time for at least one question. First question, how do you make sure to have a good system in place for training your providers on effective use of new technologies?
Anne, I think you had mentioned something about this. Do you have any thoughts on this?
I think we often make a mistake of not taking enough time to do this. It's like we don't want to take the provider's time, we don't want to take staff time, and I do think an investment of time up front is very important, because not only does it give the actual training, but it also provides the linkage back when the person is stumbling on some issue with the technology. They know who to call and how to work through the process, and I think it's critically important.
Yeah, I think the analogy of someone trained me how to use a scalpel, right? And I wouldn't just try to do that without any, practice or training or learning. So I think, technology is the same way. We need to make sure people feel comfortable before they use it.
Mm-hmm.
And also,
okay, I was just going to say, in our organizations, we have people who help with this, right? But a lot of times I'll talk to a provider and they're like, I had no idea I could call this person, or that person is my support person, or whatever. So just like, this is so basic, but just show them, introduce them to their team, their technology team, right? And I like to have people in person in the room for that.
Yeah, really good.
Unfortunately, that's all the time we have for questions today. I want to thank Davin, Kirk, and Ann once again for an excellent presentation. I would also like to thank our sponsor, Augmedix, for making today's program possible. Finally, thank you to you and our audience for participating today. We hope you'll join us in the future for another Health Leaders webinar. This concludes today's presentation.